Okay, good morning. Welcome to the Sacramento County Public Health briefing for January 20th. Just a reminder that this is the only media availability for our public health staff today and tomorrow. So please make sure you get your questions in. I will send out the link to the full recording after we are finished. So with that, I will go ahead and hand it over to Dr. Casirier.
Good morning, everyone, and thank you for joining us. So I'll start with a brief update on the numbers. We are seeing some indications of a plateau. The total number of cases we have is 230,089 cases of COVID-19 reported. We're averaging close to about 3,000 on a daily basis. And the case rate is at 190 per 100,000. This is data from yesterday. For comparison, last week it was 189. So there are indications that we're hitting a plateau. When you look at the hospitalizations, they have increased from 505 from the last report to 588. Intensive care unit from 82 increased to 92, and pediatric hospitalizations have increased from 14 to 22. The ED visits have decreased slightly, and you can see that on our dashboard and be able to follow what the numbers look like. For the jail, there are currently 47 cases of COVID-19 in the main jail compared to 76 last week on the 12th, and currently 123 cases in RCCC compared to 49 on the 12th. We continue to provide consultation with correctional health and in helping to make sure that cases that are identified are isolated. And we also provide assistance with testing. Vaccination remains the safest strategy to prevent future infections, severe disease, and death. And so we remind everyone to continue to be vigilant with masking in public places, and for those that have conditions that put them at risk, to avoid gatherings, and for people that are exhibiting symptoms to stay home. Last week we were asked about the therapeutics, so I want to give you a brief update on the therapeutics that are allocated to Sacramento County. We are getting, and this is on every 2 weeks we get an allocation, and then what we do is we then reallocate it to the different facilities and send that information to the state, which then sends it to the company that ships out the medication. So there is Paxlovid, which is an oral medication for treatment of mild to moderate COVID-19. We get about 300 allocated to Sacramento County with each allocation. And we usually have about 10 locations that get the reallocation, and that does include our jail facilities. The jail facilities get about 20 each. They're still in the process of getting their first allocation. Molnupiravir is also an oral medication for treatment of mild to moderate disease. We get about 1,220, and that is allocated to about 30 to 40 facilities, which does include CVS and Rite Aid pharmacies. Then there's Evishield, which is an intramuscular injection. It's given for pre-exposure treatment for people that are immune compromised. So there are only 2 facilities in Sacramento County that get that at UC Davis and Sutter. And this is actually a regional resource. So they get referrals, not just from Sacramento County, but from the entire region. And then Sotrovimab is an IV injection, which is a monoclonal antibody treatment We get about 180 doses, and this is distributed to hospitals. So as you can tell, we do get very limited supplies, and that is given out to the different facilities for treatment of patients. I will turn it over to Jamie.
Hi, good morning. For the past week, our Stanford wastewater group has detected decreases in SARS-CoV-2 concentrations in wastewater from Sacramento and several Bay Area wastewater treatment sites. Since these changes have occurred over several days, it looks like there is a true decrease in SARS-CoV-2 circulation and not a random fluctuation of Omicron in particular. In terms of variants, I do want to remind everybody that we are still seeing Delta in addition to Omicron. So Delta has not gone away. Several of the genotyping results that we're getting back are coming back as Delta. This may be somewhat influenced by a prioritization over more severe cases for genotyping, but there is no guarantee that if somebody gets COVID infection today, that it's going to be the Omicron variant. And so people should be very cautious about that. I'll turn it over to Nick.
Thanks, Jamie. Good morning, everyone. I'm going to talk a little bit about schools and also some home test kits. So as with most sectors in our community, schools have felt significant impact from this current surge, which unfortunately occurred right as schools were returning from their winter breaks. Schools have seen higher numbers of cases amongst students and staff than previously, which is consistent with high case rates across the entire community and does not necessarily indicate that transmission is occurring on campus. Prior to this most recent surge, due to individual level contact tracing, we were confident that most students and staff who got COVID acquired it outside of school, either from family or at social gatherings. The high case rates we are currently experiencing in our community make it difficult to identify how an individual acquired COVID, as they may have multiple exposures per day in a variety of settings, both at school and away from school. We know schools are essential to the emotional well-being of children, and keeping them open for in-person instruction remains a priority. There are no set thresholds for school closures, and our office provides consultation to schools that believe they may have a situation that warrants a closure on a case-by-case basis. Thus far, there have been a small handful of brief classroom closures, but schools have in large part remained open, and we're optimistic that that will continue. As we deal with this current surge, we continue to encourage schools to remain focused on universal face covering usage, and the importance of being fully vaccinated and boosted if eligible remains clear, especially for lessening the chances of serious disease, hospitalization, or death. The last 2 years have been challenging for many businesses and organizations, and schools are no different. First, as they adapted to offering distance learning, and now as they implement COVID testing programs, partner on vaccine clinics, and conduct contact tracing for their students and staff. This most recent surge has created staffing shortages for many schools, and it has been all hands on deck as teachers, counselors, and administrators have stepped up to cover classes. We remain committed to continuing to support them through the provision of guidance and technical assistance. So regarding some information on testing, Sacramento County Public Health has provided rapid antigen test kits through a variety of channels, including a wildly popular distribution to the general public through a recent partnership with Sacramento Public Library, as well as distributions to community-based organizations. Separate allocations of test kits have been sent to schools through the Sacramento County Office of Education. Demand for rapid antigen home test kits throughout the community remains high. We want to remind residents looking for home test kits that they can order them for free through a new federal program that allows each household to order 4 home test kits. Kits can be ordered online at covidtests.gov and are expected to ship starting late January. As a reminder, this is a federal program and not affiliated with Sacramento County Public Health in any way. It's simply another resource we wanted to share in hopes that our residents seeking home test kits can benefit from it. Back to you, Jana.
Jana will be joining us shortly. So if you have any questions, please go ahead and raise your hand or put them in the chat box. Are there any questions for the public health group? Michael, go ahead.
Hi, this is Mike from the SACB. Dr. Cecilia, those number, a couple questions about the the oral therapeutics that you mentioned. I just want to first double check that those numbers you were giving, were those weekly or every 2 weeks? And second, how are those being prioritized when there's such short supply?
It's every 2 weeks. And as you can imagine, it is very difficult with the limited numbers. We did prioritize to make sure that some of them did go to the jail because of the outbreak that they're experiencing right now. Some of them are also going to UC Davis, but they will be available to providers within the community. We do ask that folks do check, or actually they have to be given by prescription only. So providers would have to check with the pharmacy before they send someone there to make sure that the medication is available. We are going to provide an update to the providers by the system that we use for alerting providers so that they know which pharmacies have have been allocated the medication.
Thank you, Dr. Kassirier. Chris Hooks.
Hey, Dr. Kassirier, quick question on just sort of going back to the jails thing. You mentioned that you guys are obviously still providing consultation with corrections. Is there any, I mean, looking at our CCC, it's increased pretty dramatically. I mean, main jail has decreased, obviously, but is there any indication that they're heeding the advice that you guys are giving them in terms of how to sort of get this under control?
Yes, we have been working very closely with the sheriff's deputies and correctional health. As you can imagine, in a congregate setting, it is difficult to control an outbreak once it occurs, but we are working with them and meet on a regular basis, at least once a week, to assess any progress and also to provide advice when needed.
I am so sorry. I am back now. My computer had a complete shutdown. Giacomo, did you just ask that question or are you up next?
That was Chris's question. I don't know if he has anything else.
I do, but go for it.
Go ahead, Giacomo.
Thanks, Chris. Dr. Kassirier, despite, I know that we do appear that we might be leveling off, but I do know that large scale events such as ones at the Golden One Center continue to go on. Is there any concern for large scale social gatherings, and does the county plan to change any of its guidance in terms of those types of events?
We are following the state guidance for mega events. And so any of the events at Golden One Center are following the guidance to make sure that they provide vaccine verification, make sure that people who enter the facility are wearing masks, and also that they have verification of a negative test. We do recommend that people assess their personal risk. And for people that have conditions that put them at risk, that they should think about whether they need to attend certain gatherings or not. We, of course, recommend and plead with everyone that please get vaccinated, because that is the safest way for us to beat this current surge.
And then I had just one more, if I may. We have a significant unhoused population in the city and the county. How are tests getting out to the unhoused population, and are there any direct efforts for that?
I'll pass that over to Liz, who is overseeing that effort.
Yep, so we do have those kits that Nick mentioned for the at-home kits. We are working directly with shelter partners as well as unsheltered partners to make sure that those kits get out. as well as, when folks do have testing needs where it's helpful to have somebody physically on site providing tests. If it's an urgent need, we do work on a case by cases with our sheltered and unsheltered partners to get testing teams out there.
Okay, Chris, did you have another question?
Yeah, this is just more of a data question for the dashboard. I know you guys have had vaccination status cases and deaths on there. Is there any chance that that may happen for hospitalizations for us to get sort of an indication of who's being hospitalized and whether or not it's people who are fully vaccinated, have boosters, things like that, especially with the Omicron sort of having a lot of breakthrough cases?
Hi, Chris. Yeah, that's so the healthcare dashboard tab actually has a different data source than where we collect our cases and deaths. So we pull our cases and deaths from a state surveillance database called CalReady. And so information that's inputted into there it's not always up to date in terms of hospitalizations, and the healthcare dashboard has point in time healthcare information. That data set, unfortunately, it's called from the Snowflake platform that we get from CDPH. It does not include hospitalization status. And so to be able to do an analysis of vaccination status by hospitalization actually is pretty time intensive and involves merging separate data sets. So we're not able to do it in kind of a real-time basis. We do periodically look at it, but it's not something we're able to have the capacity to do on a daily or weekly basis.
Got it. Is there any indication, sort of, I guess, the demographics of vaccinations, who's being hospitalized right now? And I know we have a lot of a record number at this point of hospitalizations of people with COVID.
So I would think it's safe to assume that the demographics of the deaths is very similar to the demographics for hospitalizations, as they're a better indicator of severity.
Thank you.
Do we have any additional questions? I don't see any other hands raised. Just a reminder that this is the only media availability for public health staff. Okay, Daniel, go ahead.
Yes, I think you mentioned, I forget who mentioned that, demand was super high for the at-home testing at libraries. Do you plan to do any more of that? Sorry, the giving away the test kits at libraries. Yeah, was it Nick?
I can start, and then if anyone else wants to jump in, feel free. So yeah, we were very pleased with how the distribution and partnership with the library system went. We distributed over 91,000 tests in test kits in the span of, I think, about a day and a half. And our library partners were very satisfied with that as well, and have committed to being willing to partner on future opportunities if we do have available test kits. More recently, we've been a little more targeted in our distribution of test kits to community-based organizations and other entities that are able to get the kits out to the communities that they serve. But I think we're certainly open to partnering with the libraries again if we do have sufficient supply to do something similar.
Okay, cool. And then, sorry, can I ask one more?
Oh, go ahead.
So again, on this briefing and in past briefings, you've talked about the importance of wearing high quality masks. We know that the Biden administration is going to give some of these masks out where people can pick them up at CVS. You guys have that model for libraries, or for, you have the community testing sites. Why not give out masks to the general public, especially in places where people may not know how to buy them or be able to buy those N95s and the other KN95s, those type of things.
At this time, the supply of masks, that N95 masks that we have, we are really conserving to be able to use for healthcare systems and healthcare settings. And we do not have enough to be able to give out to the general public. We are aware of the announcement from the federal government of being able to give out masks. And definitely if an opportunity is presented to us where we are given access to masks that we can give out to the public, we will definitely make that announcement and use our partners to be able to give those masks out.
Okay, any additional questions?
I have one for Dr. Kassirier. Doctor, there's a program with the state through the Emergency Medical Services Authority where they are establishing essentially surge spaces at hospitals across the state. I believe the number was a little over 170, Kaiser, South Sacramento, and then some other ones in the region. What do you know about this program? And, you know, I know the state is expanding for surge. Do you expect, I heard that you said that, you know, we're expecting Omicron and this latest surge to kind of level off. What do you expect in, I suppose, in the coming weeks in terms of hospital capacity? And is there any concern that hospitals are going to get overrun, that we're going to see long wait times? What are you all working with the hospitals on?
So we are very appreciative for the state's assistance in being able to expand the surge capacity of several of our hospitals in the region. And so many of them are in the process of setting that up, as you've mentioned. Some of the hospitals, larger hospitals, such as Kaiser South and UC Davis, et cetera, are in that process right now. From what the state has told us from their projections, the hospitalizations will continue to go up, even though we're seeing a plateauing of the cases. So we continue to have to work very vigilantly with the hospital administrations to make sure that they have the staffing that they need, and also continue with the message to the public to make sure that they reserve the ER as well as 911 for the emergency situations only. Right now, from what we've been told, it seems like there's been a little bit of slowing down with the emergency room cases. So maybe people are heeding what we've all been trying to say, but we continue to monitor that.
Daniel, do you have another question, or is your hand just still up?
Sorry, hand's still up, but I do have another question. On that hospital stuff, could there be sites at Cal Expo or Sleep Train Arena again?
We do not anticipate seeing that, but of course, those are controlled by the state. But right now, the focus is on being able to expand the surge capacity of the hospitals that we have right now.
Okay, cool. And then talking about the plateau of cases, are we still in the same timetable that you said before in terms of the peak, where it was like the end of January, early February, or now are we kind of like, has that peak already happened?
It's a little early, too early to tell. We usually have to wait for a couple more days before we can tell where it's trending, but at least the early indications we have is that at least we might be at a plateau. The projections from the state are that in some areas may have already reached that peak, but we'll have to wait and see what happens with the next few days.
Okay, I think that we are good there. I don't see any more questions. So we're going to conclude our English language briefing and move on to our Spanish language briefing for those outlets that would like it. Just a reminder that I will send out this recording later today, hopefully within the next hour or so. And just a reminder, because we've had a lot of emails and text messages coming in to various people and entities. For anyone who has media related questions that have anything to do with COVID, they all need to filter through our COVID media inbox, which is covidmedia@saccounty.net. That helps a team of us answer them instead of having to wait on one specific person. So just a reminder to everybody to please filter all COVID-related questions through covidmedia@saccounty.net. Okay, we will move on to our Spanish language briefing here in just a second. Okay, I see Susanna on here. So Susanna, do you have any specific questions for Victor?
No, if he can just clarify again in Spanish, pues clarificar, and it has to do with where we are at hospitalizations in the county. Have we seen an increase? You know,
Oh, Susanna, you cut out there for just a second, but I think what you're looking for is just a general update briefing from Victor in Spanish.
Yeah. Mhm.
Okay.
Buenos días, Susana. Sí, el número total de casos confirmados en hospitales son de 588. En el ICU, en la sala de emergencia, son 92. El número total de casos de COVID en el condado son de 230,089 con 2,152 casos adicionales. El número total de muertes hasta el momento son de 2,598. De estas, 4 son adicionales del último reporte que recibió el condado.
And the other question is about the peak. I know that there was Dr. Kasiri, she talked about that last week, that we could see that peak kind of going towards the end of January, early February. Would that be the same for hospitalizations? I don't know if you can talk about that. Si llegaría a un punto de descenso ya para las hospitalizaciones en lo que es el mes de enero o el fin de enero para febrero.
La esperanza es de que sí llegue a lo que es lo que le llaman un plateau, o que se anivele por cierto tiempo y empiece a bajar. Entonces, vamos a continuar monitoreando los casos que estamos recibiendo, el número de casos que terminan en los hospitales, pero sí, la esperanza es de que vayamos viendo un número significante de casos que vayan bajando.
Perfect. That's it for me.
Okay, great. Do we have any other outlets that want Spanish language content, or are we good? Okay, I will take that as a no. Susanna, I'll get this out as soon as I have it ready. Thank you.
Thank you.